I'm Mark Schwartz, and this is Lori Galperin, and we're here to tell you a little bit about a very unusual program that we've set up in the Monterey-Carmel area for individuals who have addiction. Having run a residential eating disorders program for the last 10 to 15 years, what we've discovered is that it's kind of necessary but not sufficient. It's really helpful, I think, in a residential setting to get the addiction under control, to be able to stop doing what you do, whether it be alcohol, drugs, eating, restricting, hypersexuality. You know, being in a closed setting like that keeps you from acting out and helps you learn new ways of coping with the anxiety and sadness and other feelings that you've been medicating through addiction. But the problem is that after you finish phase 1 of treatment, oftentimes you're sent back home and there's a high risk of relapse. We think that the reason for that is because what one has to do is begin to deal with recovery, which is different than getting under control of the addictive behavior. And no one really tells you what recovery consists of or maps it out in any direct sort of way. And so our program is really oriented towards recovery from addiction.
I was just thinking about how often people give reasons for addiction that, to my mind, might hold true for some people, but for many people wind up being overly simplistic. So someone will say, I was 12 and I didn't feel very accepted anywhere or very valued, and I got high with this group of people and I felt good for the first time in a long time, so naturally I started getting high all the time and one thing just led to another. Sometimes with eating disorders people say things like that as well. Well, I wanted to lose weight. Welcome to America. And I went on a diet and one thing led to another and it was just a diet gone bad. Okay, that can happen. Both of those things can definitely happen. However, for many people, there's so much more going on. And the addictive behavior, whether it's starving, whether it's binging, whether it's purging, whether it's drugs, whether it's alcohol, whether it's internet porn nowadays, whatever it might be, the addiction serves an incredibly necessary purpose and function at that time in a person's life. What are the functions it serves? Well, it might create a peer group. Then again, a lot of addictions actually long-term create incredible isolation. Spending the weekend with your addiction, spending the weekend over-exercising, spending the weekend not eating so that you can't go to dinner with any of your friends that are going to dinner, is not maybe what you think about when it starts, but it's inevitably where it goes. But addictions serve functions. They serve the function of numbing other feelings that are intolerable. They serve the function of allowing you to feel something positive when all you feel is dread. They allow you to feel a sense of control over some aspect of your life, or a sense of not caring that you have control, don't have control in all the other aspects of your life. And so in many ways, addictions are a way of medicating anxiety, depression, etc. But sometimes even later, they begin to morph and to serve new functions in a person's life so that the addiction actually becomes incredibly hard to get rid of. So as Mark says, sometimes it's absolutely necessary to be in a higher level of care for a person to save their own life with the help of a staff at a hospital, at a treatment center that's residential. But then you're released. And many times a person still doesn't really know how to live without the addiction or without the eating disorder, without the thing that's really felt like their best friend for years and years and years. And so a lot of practicing of life gets lost while a person's in the throes of their addictive behavior. And so a lot of people that are very, very smart and actually very capable in certain ways who've become addicted have a hard time letting other people know that there's just a wealth of things they don't know how to do in spite of their intelligence, in spite of their capacity. And that's part of what our program deals with. It's not just maintaining abstinence or sobriety in terms of the addiction, it's learning how to live. It's learning how to live in an entirely different way. It's practicing life skills. It's getting the mentoring at some level that never had a chance to be gotten. It's learning a different way of being in the world and a different way of being in your body.
So let's talk about what our clients encounter. Oftentimes, one of the early things that happen is that they stop doing one addiction and start moving to a different one. And so they might drink more, or they might begin to move into codependency where they're getting into destructive relationships, but something else that's a substitute experience. And so it's really important that as one addiction goes down, that another one doesn't go up. And second, they find that psychiatric problems, depression, anxiety, begin to get worse. They might get suicidally depressed. So at that point, you really need to diagnose the psychiatric problem that's been masked by the addiction and make sure it gets adequately treated. Then, as Lori said, developmental problems that they hadn't encountered before. It might have been that they used their addiction in order to do well in school, gives them increased power, and all of a sudden then they feel all kinds of doubts and anxiety about their performance in school. Or they decide that they hate their job and they want to change careers, or they don't know what the hell they want to do. Oftentimes that comes from really not having a cohesive sense of self. They've always sort of defined themselves by doing what other people want or not disappointing other people in a perfectionistic kind of way. So beginning to deal with perfectionism, helping them to begin to develop a more cohesive sense of self is important. Also relationships. Relationships are oftentimes complex. Very charismatic individuals sometimes say they feel alone when they're even with people. And so helping them feel a sense of intimacy and connection with other people and to use other people as a resource. One of the things that we're specialists in is in the area of attachment. I think many of these addictions are attachment disorders where the person uses a substance or uses food as a way of feeling connected or feeling intimate. And the reason for that is because they're really afraid of other people. So it really becomes important to be able to develop social skills, deal with social anxiety, and then really show up for other people. I've worked with individuals who get 10 or 15 messages on their phone, but they don't show up to answer them. And they don't really recognize the importance of giving in a relationship in order to be able to get, or taking in a relationship as well as giving. So all those things become dealt with sort of in vivo, meaning that as they encounter it, we're able to help them see, here's the way that doesn't work, here's the way that does work, go out and try this way, and practice it in some way. I think the other areas that are important are in coaching. Sometimes with regards to eating disorder, we found that we had to work with people at the grocery store or help them go buy new jeans or just help them navigate very difficult situations. We've had people who've never pumped their own gas or used a vacuum cleaner before. And so they get scared because they don't have the ability to do things people their own age have been able to do. So we work with coaches that work with them out in the field and help them do things that they find anxiety-provoking or overwhelming. It might be, for example, a meetup group. I remember working with individuals on an outpatient basis to go to a meetup group and I'll encourage them for 7 or 8 weeks, but they won't go. So having a coach that will go with you the first couple of times and help you practice it becomes essential or you'll never do it. It's a phobia of sorts. And what you want to do with a phobia is expose the person to think of what they're most afraid of and have them begin to practice it.
And the scariest thing of all, dating. Scary. Especially for people who constructed a false self that they felt other people would accept. And now, because they had to give up a certain way of life, they had to give up that false self. So they know that's not who they are. But who are they? And what are they? And what's their claim to fame if it's not being the smartest or the thinnest or the whatever, the funniest? So it's a confusing time, and often it's the phase of treatment that's the least attended to. You know, there are many entities that exist out there that would like to pretend as though you're not having the same symptoms, you must be okay. And as we all know, it just doesn't quite work that way.
So what the program looks like is you come in and you would see Lori and I as individual therapists, and oftentimes we'll do that maybe 3 times a week and work on some of the deeper issues that are behind the addiction. Or if you have trauma from childhood or somewhere in your life, we work on those issues. Then we work in group on skills and being able to work and practice skills that a person may have in terms of, you know, being able to tolerate strong emotions, being able to identify strong emotions, mindfully being able to be in the present and be able to be effective and powerful in solving problems, dealing with self-critical messages, and so on. And then thirdly, we give homework assignments for people to practice in between sessions. In an intensive outpatient program, it's usually 3 hours of group plus individual. In a partial hospitalization program, it's 6 hours of therapy plus individual therapy. So these are very intensive programs. For some people, you can work or go to school while you're doing this. We try to do it at convenient hours. And you get lots of support. If you have an eating disorder, there's lots of meal support. You see a dietitian and follow a meal plan and get a lot of support with that. If you're having psychiatric problems, you see one of a really good psychiatrist and make sure you're being adequately treated for that also.
And it's beautiful here, which doesn't hurt. So there's a lot of activities to be able to take advantage of. Whale watching. Whale watching is very important, but that's not all. There's hiking, there's golfing, there's just walking by the ocean, there's shopping, but not if you're a compulsive shopper. Shopping's off. They're great places to eat, and if you're actually eating now, it's really a new experience to be able to enjoy it in this kind of an atmosphere where things are fresh and delicious at a variety of levels. I would say that the Monterey Peninsula is a really good place to come to your senses, which means there's a lot of sensory beauty and pleasure to be enjoyed here. And after all, that's what it's about at some level, because if your addiction was what was making life worthwhile, there have to begin to be other things that make this a place worth staying and worth inhabiting and worth being in your body to experience.
So our ultimate goal is to be able to create a life worth living. Usually the program is anywhere from a month to 3 months. You stay in an apartment where you have your own room, or you might share a room with somebody, but they're really nice and overlook the ocean. And it's really a very pleasant place to be residing.
It's not just pleasant, it's breathtakingly beautiful. Also, there are a lot of great meetings in the Monterey Peninsula area, meetings of all kinds, and really a sense of community in terms of those meetings. Clients who have come here from other places really find it supportive and refreshing in that regard.
Some people worry about having multiple addictions. We find that really most of our eating disorder clients have some issues around chemical dependency and lots of issues around relationships. Most of our chemical dependent clients have a lot of issues around food. And so there's a lot of overlap, and people will learn from one another, and people who are in the program really find it beneficial. But we're highly selective in who we accept in the program, and we're not going to accept somebody who we don't think is going to fit in or be able to benefit from what we're doing. Anyway, feel free to call Lori I and at any time and discuss your situation, and if we can be of help, this is an excellent program. Thank you.
At any time is kind of broad. Don't call it 4 a.m., but call it any reasonable time, and we'd be glad to talk to you more.